Dee and Gina from East Leeds. How does it feel for me? April 2023. What appointments have you had this month?
I had a letter come through. I thought it was from the dental hospital. Turned out it was from Wharfedale Hospital. He actually said to me, we'll send you an appointment for an x-ray and then we'll talk about what we need to do regarding my teeth. And because it was on a phone, I waited for the thing coming through, the appointment, and I must have waited about 3 or 4 months. Phoned the dental hospital and went, oh, we didn't get in touch with you. It was Wharfedale that had been in touch. And because you didn't go for the x-ray straight away, which you would have done if you'd been in the hospital, they assumed that I'd just not gone for the x-ray and totally dismissed.
They put it down as they thought it was a physical appointment.
Yeah.
So they just said, you didn't go to the x-ray. They said, well, no, it's a phone call appointment.
I went yesterday for my pre-assessment and I'm going in hospital next Thursday. And it actually was made, I'd not really thought much about it apart from I'm going to be asleep for it, I'm not going to feel it. And then the surgeon that I was talking to said, well, you're on a CPAP machine, so probably should warn you that I've had a couple of little problems with people with CPAP machines. And he left it at that, he didn't explain it, so I got myself a bit upset about that and stressed out. And the nurse that was seeing to me today, she said, look, don't worry about it. I weigh a lot more than you do. I know what you're worrying about, don't panic.
Can you tell us about your physio appointment?
I should have had a face-to-face physio appointment. And I've been attacked actually last week. And obviously the next day I really wasn't feeling up to going anywhere. And I'd phoned them up and I said, well, I'm really sorry, I've got to cancel. Can we arrange another appointment? Yeah, it's not a problem. Actually, we won't rearrange another appointment. We'll just get your physiotherapist to ring you at the normal time that your appointment would be, so you can have the appointment still, it won't count against you. And never thought anything about it until it was about 5:30. And then I realised they'd not actually phoned me and it was too late then to try and ring them. And then the next day I got a text saying if I miss another appointment, I'm going to be kicked off the books altogether. And I'd got 7 days then to get an appointment. Yeah, I did ring them actually the next day. No answer, nobody phoned me back. And then I got a text saying because I'd missed the appointment altogether, probably not going to get back. It was with Osmond Thorpe Lane physiotherapy. It's the muscular skeletal service. Yeah, I'm in pain and yeah, I'm going to suffer now because I don't have the energy to fight.
What is your biggest concern at the moment with regard to your healthcare needs?
So in relation to getting a diagnosis for the Asperger's, autism, I'm still trying to work out how to get a adult social care worker so that I can actually get them to hopefully refer me through to get a diagnosis. It's working out how I do that. Yeah. I started speaking with somebody from Space 2 about a couple of years ago about getting ideas on how to do it. I then spoke to Lincoln Leeds and they said, well, lads will do it, but you need to get a referral from your GP. I spoke to a GP at our surgery, but she wasn't my own. And because there was no written things down on my file about it, she went, we won't authorise funding. And then started just barraging a load of questions at me, like, why do you think you're autistic? What symptoms have you got? And they said, I just sort of froze up and went,
If you could offer any advice to improve services for others, what would it be?
The hospital transport. I'd got an appointment to go to the hospital. I'd gone in my wheelchair, but I had stood up and I'd gone to get into the car. The taxi driver said, just a minute, what are you doing? I said, I'm getting in a taxi. And he says, no, you can't do that. Well, because we need to have you tied into the back of the chair. Well, we've got special bands, you know, have you got a seatbelt? And I said, yeah, I've got a seatbelt, but it won't long enough to go around me. And he said, well, I can't have you in without a wheelchair. without a seatbelt on. They have actually been stopped from taking me to the hospital now, the streamline taxis. Ambulances can take me, but the taxis can't. And I just thought, I don't have a problem getting out of my wheelchair and sitting in the back of the car.
We can't transfer patients from wheelchair to the car. I won't get paid for that. So he lost us that appointment. Because we thought he was going to go off and send another patient transport and say, right, I can't do this job, can you send alternative transport? We actually got him phoned up patient transport services and he just cancelled the job. I think as long as they're talking to each other and keeping ourselves in the loop as well with things that are being improved, sort of making sure that communication's there all the time and explaining things clearer. So not leaving you sort of thinking, what does that mean?
Thanks to Dee and Gina for sharing their story. Produced by Health Watch Leeds in collaboration with Halcyon B and Rodara.